is Dr. Jones, and you are here for a hearing test today, is that correct? There we go, excellent. To begin with, I just need to ask you some basic information and then a few questions just to gather some information regarding your ear health and medical history. Okay, so first of all, what is your name? Could you spell out your first and second name for me, please? Marvelous. And date of birth? Current residence? And for the first question today, are there any allergies you have that I should be aware of, including a latex allergy perhaps? Okay. Do you have a family history of ear infections, hearing problems, sinus problems, anything like that? Okay. And have you personally had any ear infections before? Okay, next question. Have you ever had an incident of impacted earwax, and have you ever had to go to have a professional ear cleaning? Okay. Have you ever had any trauma to the head or perhaps the ear specifically? Any accidents of that nature? Okay. And can I just briefly ask, what is your profession? What do you do for a job? I'm just wondering if you are exposed to loud noises on a daily basis or anything like that. And what about hobbies? Do you do things like go to gigs, go to festivals, concerts, anything that might expose you to loud noises? And how often would you say that is? Okay, so that's all the questions I want to ask you. Is there anything you would like to mention to me? Any specific hearing problems you're having? Okay. necessary for me to do a quick ear cleaning on you today. Shouldn't take too long. It won't be painful or anything like that. Could even be quite pleasant and relaxing. Okay, but before I do that, I just want to do a very basic, rudimentary hearing test, just to get a gauge on the state of your hearing now. Then I will do the ear cleaning, and we will repeat the hearing test to see if there is any improvement in your hearing, which is obviously what we're hoping for. Okay, so if you could close your eyes for me, please. I'm going to wiggle my fingers in one of your ears, or possibly both, and I would just like you to tell me, please, left, right, or both, whichever you hear the sound in, whichever ear you hear it in. Okay, so we'll begin doing that now. Very good. Very good. Very good. 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 Very good. Okay. You can open your eyes now. Now I would like you to tell me when you can no longer hear the sound I'm producing. I'm going to be moving my hands further and further away from your ear. And again, if you can just let me know when you can no longer hear this sound, please. There we go, very good. And now we try the other ear. Very good. We'll try both ears at once. Good stuff. Just want to try. Very good. I want to try individual ears. There we go. Okay, that's good, that's good. And now I'm going to be whispering some words or numbers into your ears, and I'd like you to repeat it back to me, please, whatever you hear. Okay, so we'll begin doing that now. Cat. Good. Dog. Good. 77. Good. 66. Good. Tomato. Good. Cucumber. Good. 173. Good. 666. Good. Mortgage. Good. Foreclosure. Good, very good. Happy with those results. And now I do believe I'll begin cleaning your ears out. We'll repeat the test as I already mentioned and see if we can get a little bit of improvement on your hearing abilities. Okay, so I'm just going to begin with this ear now. I'm going to start off with just a simple cotton bud, and I'm going to be doing the outside of the ears. I'll be doing the outer areas of the ear canal as well. Okay. Okay, so of course during this time, if you do feel Okay, so again, I'm going to be moving on to the metal tools now. I'm going to be very careful, of course, once again. Should feel pretty much exactly the same as the other ear. Okay. How's that? It's quite gentle, that one, yeah. Yeah, this is just to help me loosen and remove the more stubborn pieces of earwax. Yeah, I'll be moving on to the final implemented tool now. This tool being the sharpest and probably the most intense feeling, but of course, being very careful once again. How is that feeling? Is that okay? Well, that's a very loud car outside, isn't it? Having an absolute party in there. Oh, that's a stubborn piece. Okay, there we go. There we go. Very good, I think. I think that's everything. Okay, so now I just want to quickly repeat the hearing test that we performed earlier, and if you could let me know if you notice any significant improvement, that would be great. Okay, so I'll begin by wiggling my fingers in each of your ears, and if you could tell me left, right, or both, whichever ear you hear the sound in. Okay, so if you could close your eyes for me now, please. Very good. Marvelous. Good. 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 Good, very good. You can open your eyes now. How did that sound in comparison to earlier? Some improvement. It sounded louder. Yeah, that's great. That's good to hear, because I am doing it exactly the same distance from your ears, so an increase in volume signifies that we have some improved hearing. Okay, so now I want to check your hearing range. Same test as before. If you could just tell me when you can no longer hear the sound, please. Okay, so here we go. Very good. Very good. Very good. Very good. Very good, very good. That was clearly an increase in your hearing range as well. Again, very good sign. And now I will just briefly whisper a few words and numbers into your ears. Again, if you can repeat them back to me, please. Here we go. Marshmallow. Good. Gummy bear. Good. 39. Good. 96. Good. Optometrist. Very good. Ophthalmoscope. Very good. So, any problems hearing those? No muffled sounds, no. I mean, everything seems very good to me now. It seems like there has been an improvement in your hearing since before the ear cleaning session that we did today. Are there any questions you have for me? Any concerns? No, I think everything has gone very well indeed today. Okay, so before I send you on your way, I just want to put some solution into your ears. This is going to help to cool them down, so to speak. They might be feeling a little bit raw, perhaps inflamed, you could describe it as now, because obviously I have been digging around inside your ears with some tools. So this solution is just going to give you some relief from that feeling, and it's also going to clean out the ears a final time to remove any debris that I may have loosened but not extracted. Okay. Okay, if you could tilt your head to the side for me, please. I'm just going to tip a couple of drops into that ear. Very good. If you could tilt your head to the other side now for me, please. Same thing. Just going to tip a few drops into that ear. There we go. You don't need to worry about cleaning that solution out. Just leave it alone to work its magic, and it will dry up and leave the ear naturally. Okay, so I do believe that concludes today's hearing test and ear cleaning session. I hope you've had a positive experience. Once again, is there anything else I can do for you before we finish today? No, all okay. There we go then. Thank you very much for sitting so well during the ear cleaning session and for performing so well as well. Thank you for being here. Thank you. Take care. Have a good day.